Hello, everyone. Today you're joined with Kelsey and I, and also Dr. Sunny Winstead. She is the associate professor, right?
Yep.
Associate professor of occupational therapy. If you'd like to introduce yourself.
Good. Well, good morning, John and Kelsey and everyone else. Thanks very much for having me here. This sounds like a great course and an exciting topic. As John said, I'm Dr. Sunny Winstead. I've been with the occupational therapy program here at CUCA I'm going into my 8th year, and I've been an occupational therapist for, hard to say, over 20 years. So I've worked for quite a few years as an occupational therapist, working with mostly adults with a variety of disabilities and other kinds of conditions that sort of limited the things they could do in their life. And OTs really focus on helping people be as independent as they can. So I had many, many years in that capacity. And then I kind of shifted my career into academia. And now I get the chance to be an OT who helps the next generation of OTs learn about how to do what we do. So here at CUCA, my teaching focus has been kind of two main areas, one being the evaluation and treatment of adults in occupational therapy, and then the second being research and scholarship, which is a lot more exciting than it sounds.
It is.
Right, Kelsey?
Yeah, it's a lot of fun.
So, since you guys are both occupational therapists, can I ask you what you guys are your favorite classes that you're taking right now at CUCA? I guess for Kelsey, what's the one that's maybe not incredibly hard and scary, but a
Well,
favorite
this,
course?
this is kind of weird, but my favorite is anatomy. Like anything to do with anatomy. I think it's probably kind of hard, but it's really fun. So.
Yeah, and Kelsey, I can remember, even though I was in OT school 25 years ago, I remember anatomy as one of my favorites too, because it's just like it's bringing this whole world alive to you that you never really knew exactly what's going on inside the body. And no matter what area of practice you work in, and OTs can work with everyone from babies in the NICU all the way through older adults at the end of their life. But we always, in the back of our minds, have that ability to analyze what's going on with the person, and that includes what's going on with their movement when they do different activities. So anatomy is a good one to definitely pay attention and enjoy, because you will use it all through your whole careers for sure.
Mm-hmm.
If I remember correctly, you guys do 2 semesters of anatomy, correct?
Yeah, we started with anatomy and physiology, and then anatomy and kinesiology.
Mm-hmm. And then it's one of those topics that gets kind of, again, sort of pulled through the curriculum. So you learn the basics with Dr. Young in your sort of your true science classes, but then the next semester you'll be learning about how to treat a rotator cuff injury, for example. And so your professor at that point will say, well, you remember what the muscles of the rotator cuff are, right, Kelsey? Do you? and then you'll scramble for a few minutes, right, mentally, like trying to remember them, or pull out your phone or whatever. But then you'll take that knowledge and you'll get to use it and say, okay, so you understand what it means anatomically. So what would we actually do to evaluate that and then to treat the problem? So I agree. I like that too. Kelsey did not take the easy route of saying that her favorite course is research methods.
I liked it though; it was fun.
In your sophomore year, you learn research methods, and that's been a class that I've taught the last bunch of years. And it's another topic, kind of like anatomy. And John, I'm guessing this is the same for you in your program, that you have foundational courses like research methods or anatomy that then pull through the curriculum.
Yeah, I liked I took the psych experimental methods of Dr. Hallam, and it's actually a fun course because you get to understand how to actually complete a study, how to actually do it, and why to do it a certain way, in order to make sense out of it.
And so many majors, we're the three of us are coming from sort of a health and human services perspective, but nowadays, almost every profession has a real emphasis toward what we call evidence-based practice. And that, it's that idea, whether you're a business major or a social work major or an OT, that you need to be able to understand research so that you can use it to make good decisions in your own particular field of practice. So I think a lot of you listening, no matter what your field is, you'll find that there are definitely these commonalities in some of the courses you take in your first year or two that then get moved through the curriculum as you progress.
Kelsey, if you'd like to go.
So what do you want me to say?
You can ask any question you want. Go ahead.
Oh my gosh, I don't know what to ask. Like, I don't know. I feel like this isn't really much of a question. It's just kind of a statement about how both John and I like get to work out with you in the gym.
Oh
And,
yeah.
like, I even run into like other professors like in the gym and stuff, and I just think it's cool because it's like another way to be able to connect with them like outside of the classroom and stuff like that.
I kind of wondered if that was going to come up here. Yeah, so Kelsey and I knew each other in class first, but John and I met first just randomly, making early morning small talk at the gym. And it is totally true. When I think back to my undergrad and grad experience both, you know, I never knew my professors on any kind of a personal level. And so I do think that that's one of the things that so many students really value at CUCA, which is, no joke. You meet your professors in the, in the weight room.
Yeah.
And it's like that was a challenging kind of time for me, to be honest, because I've struggled to really try to improve my health and fitness, especially over the last few years. And so something like going to the weight room felt kind of intimidating. I didn't really know exactly what to do with all the equipment. I wasn't strong. I felt like it was going to be embarrassing to go in there with people that were, mostly a whole lot younger and a whole lot fitter. But again, just the connection and friendliness and being able to, I don't know, I just very quickly did get comfortable. And I had several young people who showed me how to do different things on the equipment and just made me feel like, like I could belong there. And I do think that is kind of part of the magic of CUCA. And it kind of goes both ways. Like, you guys hopefully feel it with us, but we feel it with you too.
Yeah. It was interesting when I first saw you. I was like, isn't that the Sunny Winstead? Is that the Sunny?
That is true, right? Because I probably introduced myself just by first name.
Yeah.
In that context, I wouldn't have called myself Dr. Winstead. Yeah.
That's cool. So also talking about your first name, Sunny, do you see yourself as more optimistic or more pessimistic? Because since part of the module that we'll be talking about is positive thinking.
Well, I definitely see myself as an optimist. I think we all know that challenging things happen in life, right? So, we can't pretend that there are never hard times or difficult situations or, times when we don't feel good about ourselves. But that said, in the big picture, I'm always an optimist. I'm an optimist, when at the micro level, as a parent. I'm an optimist with my students. I'm an optimist when I think about, my profession and our ability to have an impact on people's lives. And then I'm an optimist in the big picture of, kind of where the world and where our, sort of society in general can be going in the longer run. So yes, I consider myself an optimist. And I will say, as a healthcare provider, and I know many of you will be in professions where you work with people, you have so many opportunities to see people struggle. And if you can bring them a little bit of your own positivity, it can often make a really big difference. Can I digress with a small example?
Go for it. Yeah.
Because as an OT for, I did calculate, it's been 24 years, so that's a long time. Um, I've worked with many patients who've struggled with challenging things, and I've always seen it as my job to not pretend that things aren't hard, because sometimes things really are hard, for patients, for my students sometimes, but at the same time to try to bring some positivity. So I was thinking about a man that I worked with. I was working at the VA Medical Center down in Richmond, which had a big traumatic brain injury program. And he was an active duty Marine who had been injured and was receiving rehabilitation services on the TBI unit, traumatic brain injury. And so when I met him, he was this really like big, strong, sort of physically imposing kind of person. But he had some really significant physical limitations because of his brain injury, because everyone understands the basic idea that your brain controls the movements of your body. And so he didn't have much function or movement in his right arm and hand when I first met him. And so I remember early in one day when we were just talking, and he was really down, and he was just saying, Sonny, this just isn't me. I don't know how I can go on like this, and he was talking about how strong he used to be. And he said, and now, he said, I couldn't even beat you in arm wrestling. And I was like, well, yeah, that's probably true, right? Because I do think it's important to not try to just sugarcoat everything. Like we both knew that was true. So I said, well, that's probably true. And then I stopped for a second and I said, but I'm just going to call him Steve. Mm-hmm. But Steve, what about thumb wrestling? And he just looked at me, and he looked at me like, what are you talking about? And I said, well, I don't know. Let's see. So, and, we're both competitive people, right? So we put out our hands, and the thumb wrestle. Now you got to remember, I'm a fairly small person. My hand is quite small. His hand was quite huge, but he also had significant impairments from his injury. So the first time that we thumb wrestled, I just went ahead and beat him. Because that's reality. He would have known if I was faking. Yeah. But it lit this fire in him, and it became at first a joke, but it became this thing that sort of picked up steam. And so the next time that I saw him, he said, hey, let's want to thumb wrestle again. So at the end of our occupational therapy session, we're like, okay, let's thumb wrestle. So we did. I beat him again. But it became like this thing. And then I noticed that a few days later, when I was out on the unit, I overheard him challenging one of the nurses to a thumb wrestling match. And it became like this thing. And then the next thing you know, when his family came in, they were thumb wrestling. And so by finding like this small piece of something that was sometimes what we call it in OT is the just right challenge. Mm-hmm. It's like, find that thing that can help somebody feel a little sense of accomplishment. It's not so big that they can't do it, but it's still something that can be meaningful. And so I think about that idea a lot. I remember Steve from many years ago, but that general idea that you can take something negative, but you can find something small in it. And sometimes that can lead to other things. And eventually, the end of Steve's story was really positive. It wasn't actually too long before he could beat me for real in thumb wrestling. Because he was doing it all the time. And one of the things that we're, as OTs, we always want people to like practice the skills, and a lot of times it's hard to motivate them. But this tiny little competitive thing became really motivating for Steve. And he actually ended up getting really great functional return in his hand. I'm not sure that it was just because of the thumb wrestling, but it didn't hurt, right? Yeah. So I know that's a long way to the side, but I often think of my own role, whether I'm, acting as an OT or I'm acting as an advisor to students or an instructor to students, of trying to find, like, sometimes it's just finding a small starting point that can help the person move toward something more positive for themselves.
Ironically, in one of the modules, we do talk about getting the ball rolling, which is just another example of what you just talked about was
Mm-hmm.
where we asked them to clean a small part of their room. So we asked them to go into the room, into um, their bedroom, and just sit down at the edge of your bed and look around and see if there's something that's bothering you.
Mm-hmm.
And if there's something that's bothering you, whether it's water bottles on the nightstand or like some like hot pocket like wrappers or whatever,
Mm-hmm.
uh, just to go and clean it. Go ahead and fix it. If there's a little chip on your dresser, go ahead and see if you could fix it. Um, just lowering your competency, basically, from all the way from arm wrestling to thumb wrestling,
Right.
to try and get that zone of proximal development
Mm-hmm.
that I'm sure
Yeah,
you guys talk about.
and that's you're using the exact words for what I, as a clinician would call that just right challenge.
Yeah,
Don't set your sights so high that it's just overwhelming, but set it someplace that's meaningful, and then you make a small success, and then it can lead you to the confidence to try for another success.
I mean, no doubt he wanted to be able to, use his full body again.
Yes.
So obviously that goal is in mind, but let's take these small, meaningful steps
Right.
that can steamroll. Yeah.
Mm-hmm. Yeah.
And then even taking that into like the academic level, like at school, you don't want to wait until the night before your exam to like cram it all in. You want to do like the slow once a night thing and build up to it.
Yeah. Yeah. That repetitive task work. Yeah.
Mm-hmm.
Mm-hmm.
Yeah, and I often suggest that, Kelsey, to students who are struggling, because it can seem
Mm-hmm.
sometimes like, it can seem like this mountain. It's too hard to climb, but then thinking about the idea of doing a piece at a time, and like you
Mm-hmm.
said, John, even if it's something that seems really small, it's amazing how small things can, sort of start
Yeah.
to build your sense that you can do other things.
Yeah.
And I think,
Especially, oh, go ahead.
no,
Go ahead.
well, I was just wondering, like, for you guys thinking back, you're obviously now both successful students here at the college, but did you have times at the beginning where you felt intimidated or you felt like something was too big to tackle?
Yeah. This doesn't even have to do with like classes, but like the first week of freshman year, I hate like I love meeting new people, but I'm really shy about like
Hmm.
being the person to put myself out there. So that was like my main struggle like freshman year. I didn't know who to talk to. I didn't really like have my people or like anything. I wasn't like putting myself out there enough. Um but then like later through fall semester, I like met like one person and then it like just like
Hmm.
slowly started growing there. But like when you first get onto campus and there's like so many new people around you, it's just like it's such like a panic type thing because like you don't know what to do. Like
Yeah. It's a very daunting kind
yeah.
of experience
Yeah.
sometimes.
Yeah. And one of the nice things that CUCA has, you both know, is an active connection between students and their academic
Mm-hmm.
advisors right from the start. So I'm not sure about all programs, but I think they're pretty similar. We in OT will meet students
Mm-hmm.
during the move-in week, and so they get to know right away who their academic advisor is. So I've advised a lot of students from that first August, and I think you're right, Kelsey. It's good for people to remember that, however you're feeling, probably
Mm-hmm.
a lot of other people are feeling that way
Yeah.
too, even if maybe you think they're not showing it.
Mm-hmm.
Yeah.
It's good to remember, and like I shared my own discomfort with going to the gym for the first time,
Mm-hmm.
the weight room. You got to go down the stairs into the basement, and you don't know who's going to be there until you open the door, because it's like a solid door, so you don't know if there's going to be a whole room of people who are all going to turn and look at you. um, but so even at my age, and with my experience, you can still have those things that make you
Mm-hmm.
uncomfortable, but especially at the beginning when things are new.
Yeah.
So I like what you said about finding, starting small, starting with one or two
Mm-hmm.
connections, and then kind of going from there. How
Yeah.
about you, John? Did you?
When I was a nursing student, because I don't know if you know, now I'm into psychology. Now I'm a
Yes.
full blown psych.
Mm-hmm.
When I was in nursing, it was a lot of, um, yeah, just like that first time when you're introducing yourself to a patient, you're like, okay, all right, I hope this patient just doesn't go, screw you and like leave me alone, you know. But you come and approach it in an honest way, in an honest manner, and that just that little catalyst allows you to continually do it,
Mm-hmm.
and at least in nursing. um,
Mm-hmm.
I know it was nice to have a team around you, and because other people are going through the ringer with you.
Mm-hmm.
You're
Right.
not the only one. um, I don't think any major here on campus where you'll be the only one. um,
Mm-hmm. Right.
so um, there's
And I
always
think
someone to look to.
Kelsey makes a really good point that I've seen a lot with my advisees over the years, especially maybe in freshman and sophomore year, is that sometimes I think people have the idea that you have to be a certain way to be successful.
Mhm.
So I've seen this a lot from the advising side. Students who go out maybe on their first field period, and they're very, very quiet. They feel uncomfortable. Kelsey is not my advisee, just so you know. But I've certainly seen many advisees who were very uncomfortable in that first field period, didn't really know how to talk to people, what to do, how to fit in. Um, and then I've definitely had students come back to my office afterwards and say, Dr. Winstead, it was just so hard. I don't think I'm cut out to be an OT because I just did not know how to connect with people. I'm too quiet, I'm too reserved. And I always really say to people that I think one of the key things to me about thinking positively is recognizing, being able to reflect on yourself and being able to really be honest with yourself about things you want to improve. That's generally easy, but also things that are your strengths. And they don't have to necessarily be the same things as everybody else. So, in other words, you don't have to be the very, very talkative, outgoing, make a million friends kind of person to be successful in field period or in your
Mhm.
program, or in your future careers. There are all kinds of different people out there. I'm a very reserved person myself, believe it or not, even though I do stand up in the front of a room and talk for a
Mhm.
living. That has never been just super easy for me. So I really try to get students, especially at the start, to reflect, what are you good at? Yes, what do you want to improve? That's fine, but really focusing on what you're good at, and then thinking about how you can embrace that and make that really work for you. So, for example, if you're a quiet person, you might think, as many advisees have said to me, like, oh, I'm never going to be able to talk to patients,
Yeah.
you know, but in reality, the quiet therapist or the quiet nurse or social worker often is incredibly effective because they have a great ability to do what?
Listen.
Listen. Yeah. Where the really talkative, outgoing person sometimes is talking so much and that they're not really hearing what the client is saying. Um, so I really encourage students to kind of take that lesson that you can take whatever is true about yourself and you can make that a strength that you can build on. Um, but it does take that process of kind of reflection, being honest about who you are,
Yeah.
and then I think it's helpful to have somebody that can, maybe help you work through that a little bit. So if you have a
Mhm.
good advisor or an instructor or supervisor that you like, or a coach, that can be really valuable, I think.
Yeah.
Well,
Like, oh, go ahead. Go ahead.
I was just gonna add on to the field period part. So, you had said about like your freshman year, like being like the first one where you're really shy. I still had that sophomore year.
Hmm.
And literally, my second day at my field period, my supervisor pulled me into his office and told me that I sucked pretty much. And that he was like, telling me that I needed to start talking to patients, and like that if I wasn't going to, I wasn't gonna get anything like out of the field period. And it was like really uncomfortable, like hearing that from somebody that was like a complete stranger to me.
Mm-hmm.
But after like getting told that, I was like, okay, shoot, like I really gotta like start doing something if I want anything from this field period.
Yeah.
Um, but it was awkward because we had to like sit straight across from like the patients at a table. We were like really close to them. So I started with the like outgoing patients, and I would sit across from them because they would be like the ones that would like initiate things, and they would like always want to keep the conversation going. And like once I gained confidence talking to them, I started going over to the ones that were like more in their shell, and I would like introduce myself to them and like kind of use the skills I learned from the other patients to them
Mm-hmm.
so that I could get like more comfortable with it. And then towards the end of that field period, my supervisor told me that he was really proud of me coming out of my shell and like
Mm-hmm.
starting to step up a little bit. And now I really wish I could go back there because I actually really liked it there.
Well, that's cool for two things. One is that's another great example of what we started talking about today, that idea of sort of small steps leading up. But I think also, Kelsey, making a really good point that people grow and change so much over the 4 years or so that you're here at the college. And so as an advisor, I often am just amazed when I think back to, when I met somebody on the first day of freshman year, and then I see where they are 4 years later. So if you can then reflect on that and feel proud of the steps you make, I think that's a really, really important part of growth for everyone that's listening. Not necessarily your bar is going to, your goal is going to be unique to you, but if you can find a way to say, I made some progress, and it doesn't have to be the same progress as everybody else, but like, so for Kelsey, being able to talk to a patient was a huge success, right?
Yeah.
And you found a way to celebrate that
Mm-hmm.
by thinking about it and kind of reflecting on it. And then the next time you had to do it, you were a step up, right? You had developed, you'd grown. Yeah,
Yeah.
that's great.
One of the key things that we want to get across is to not compare to your other peers. I mean,
Yeah.
if you start comparing, there's going to be someone that's going to be better than you. So like if
Well,
you
because then you get like in your head and you get all intimidated. And this is like a side note, but at that same internship on my second last week, a level 2 came in. And I was like, great, this kid's gonna know absolutely everything, and I'm gonna be like pushed to the side. But I ended up actually having to show him how to do like the measurements and stuff, which was like felt it like gave me some confidence because I was like, ooh, like
Yeah.
in I just wanted to touch on the field period. You talked about reflecting a lot, and one of the best things that you can do is reflecting on, in, and for. And so reflecting on the situation, so that's a past tense. Reflecting after. Kelsey reflected after. She even recognized that she wasn't really speaking to patients, and then reflecting in the situation when she probably had her first instance of actually talking to a patient, and then recognizing, oh wow, like, okay, I'm competent enough to do this. And then reflecting for, she went from individual to more of other people, and even if people who weren't in their shell, and she was able to approach them. um, that's one of the cool things about the field period, is that when I did field period my first time, I was all over in different departments of the hospital, anywhere from OR to the ICU to the ED and even OB, and just kind of seeing and watching people and being able to interact with patients, reflecting on situations that I can even help it. Um, it's interesting just shadowing and doing an internship, even at a hospital, when you're not supposed to be touching a patient, or you're not like opening up a gallbladder, like you're not taking out a gallbladder or anything like that, but you can still have those instances where you can approach the situation as if you were to.
Yeah.
in talking about reflection, you know, and I'm sure Kelsey kind of did this to kind of kick herself in the butt about this, you know, self-talk. One of the questions that we pose to you is, you know, what is your self-talk like? Um, Maybe in instances where you feel like you have a low self-esteem, just like the weight room, when you're walking up to that black door that we have, the infamous black door. Um, what does your self-talk look like?
Well, I think in hard situations, my self-talk is to acknowledge that it's hard, but then give myself the positive. So just like I, shared in the story of the patient Steve, I didn't try to pretend to him that everything was great because, he had a paralyzed right arm. And it's the same with myself. I try to tell myself, yes, this is challenging, but you can handle it. Um, and that's the general gist. Obviously, it's going to depend a little on the situation, but again, I think it's okay to recognize that we all face things that are hard, but that doesn't mean that you can't move past it. And then I really do like the idea of trying to take a moment, because the other thing that I find, and I find this for myself, but for students as well, that sometimes when things are hard or negative or there's conflict or whatever the situation is that's not ideal, there's a tendency to kind of react to that sort of quickly. Um, I started my doctorate back in 2014. I had been an occupational therapist for all those years, but when I became a faculty member, I wanted and needed to go and get my doctorate. And I remember starting the program, and it was really, really hard. I was working full time. I had three sons at home who were, I don't know, 10, 12, and 14, kind of in that range. My husband and I ran a business. Like, it was just a lot. And all of a sudden I had between 20 and 25 extra hours of work every week for the doctorate. And it was really challenging. And I remember at the beginning feeling like, what on earth did I get myself into? Like, how am I going to be able to do this? And I distinctly remember there was another man in the class. Just coincidentally, he actually lived sort of relatively near me in the state, even though we had people from all over the world. So he and I had sort of made a little connection right at the beginning. And he had sort of the same kind of experience at the beginning. It was very hard. He was overwhelmed with the work level. And he, just emailed me one night and said, Sonny, I'm going to quit. And he, I don't know, we were just a week or two in. He said, I'm going to quit. I'm not cut out for it. It's too much. And I said, gosh, maybe you can just give it a little bit more time. And so that's one of the things that I also think about with self-talk and positivity in general, is to not react too quickly to a negative or challenging situation. So whether that means don't immediately text something mean right back, right? Like someone texts something or says something or whatever, and you want to immediately send a response. I never do that. I always say, nope, I'm gonna think about this. And likewise, I don't make quick decisions about myself. Like, if I feel like something's going wrong or it's not the way I want it to be, I try not to react right away and say, oh, I'm just gonna quit. Like my colleague in the doctoral program, I try to really let a little bit of time pass. Sometimes it's helpful to talk to another person. That kind of depends who you are. I'm more of an introvert. I tend to mostly reflect with myself, but I know that some people really benefit from taking that pause and, talking to a friend or talking to, here at the college, a coach or a faculty member or your mom or whoever. So it kind of depends, but I do think that that's an important part of the self processing process as well, which is finding a way to become a person who can take a little pause and not make an immediate reaction to something that feels negative. Does
Yeah.
that ring true to you guys? What do you think?
One of the one of the things that some students will learn if they're science major or psych, um, is talking about that fear, that initial reaction of fear, because your body doesn't really care what the fear is. It if you have any inclination of fear or anxiousness, your body is basically telling you there's a tiger in the room and we need to get out.
Get away. Yeah.
It doesn't matter what the severity is necessarily. Uh, the only reason the severity matters is when you make the psychological decision to create a pause and say, okay, I don't have to lash out. The body is already saying, there's a tiger in the room. We need to get out. Instant, go. Do whatever you can for survival. So yeah, taking that pause is really important, just to create that mind-body connection, saying, okay, well, this isn't really a tiger in the room. This is more like a fly in the wall that's annoying you.
Right.
Let's really think about this. In another symbolic way is let's see what tools we can use. Okay, we can use a fly swatter to kill this fly. Okay.
Yeah. And I think the pause and the reflection, those are both strategies that kind of work together, because if you can take that moment to pause, it's also a moment to reflect, like, what's really going on here? When I'm standing outside that black door to the weight room and I can hear people on the other side and I'm feeling embarrassed, right? I think this is going to be really awkward, or, whatever. Or I'm at the start of my doctoral program and I'm thinking, yikes, I can't do this. If you can pause, that's also the opportunity for you to say, why am I feeling this way? And then, as in Kelsey's example with field period, what can I do? Why am I feeling this way? And then what do I want to do? So it becomes more of an intentional choice rather than just kind of a reaction.
Also kind of changing it from an external locus of control to internal.
Yeah, absolutely.
Yeah.
Yep.
Trying to.
And like, sorry.
No, go ahead.
Not being like afraid to reach out to people, like if you need it. Like if you like are scared of something and somebody can help you, like use that to your advantage. Don't like be like, oh, maybe they're gonna think I'm weird or something. Like you're gonna have people on your sides, so like use them.
Yeah.
What have you found, Kelsey? Like, what's been helpful to you when you needed to reach out and get someone else's perspective, to be more positive? Like, what have you done?
So my friends actually kind of pick on me for this. I FaceTime my mom every single night when I'm at school. Literally every single night I'll like call her. So that's been like my kind of like thing has been I like every single day, no matter like if I'm having a good day or not, I know for a fact like I'm gonna get to see my family at night and like take my mind off of it. Or like the one time I felt so bad after, but I was like having such a bad day and I called my mom and I was like screaming at the phone, like just letting it all out. But then like the next day, like she texted me in the morning, like making sure I was like calm down and okay and stuff. And like, yeah, that's just been my like thing has been having that.
The other thing I think, and I'm not sure, your perspective might be different, but I think that if you can think about surrounding yourself with people who are positive supports,
Yeah,
that can be
definitely.
very helpful, because I'm guessing that you as students and probably everyone listening can think of a time where you got involved with a situation that was kind of negative, and the person that you talked to actually made it worse by sort of adding on to the negativity, because just like positivity can snowball, so can negativity.
Yeah.
So I certainly, as an advisor and a professor, have had situations where students have come to me to say, Dr. Winstead, this whole thing has gotten out of control. She said this happened, and a lot of times what needs to happen is a pause, but also sometimes people need to step away from other people who are not being a positive influence. So have you ever had that experience?
There's a.
Yeah.
Oh, go ahead. Yeah.
Like
Yeah.
like especially with the group projects or something, if you just have one person and it's like, oh, this project's stupid, like it just kind of like rolls into it. It's like
Right.
it's a good thing to just even have like one person like break that chain and be like, no, like this is actually really cool. We can use it for like this, and then like the project switches.
Yeah. Funny, right? It's the same exact project, but your attitude to it makes a total
Yeah.
difference. I think that's so true. Yeah.
One of the pluses to going to college is that you're creating a new friend group, basically. So
Mhm.
you're creating this blank slate. And what's great about going to college is that if you have your initial friend group and maybe one of them isn't such a good friend, and one of the best ways that you can find out if someone's a good friend or not is when you give them bad news. Like we had talked, like you had just touched on a couple of minutes ago, was, you know, if you give someone bad news and then they add to the net negative
Mm-hmm.
on the situation, or maybe they have something worse that they want to express to you, you
Or
know.
like the fake positivity type thing, like you
Yeah,
can kind
like
of see it.
I,
Mm-hmm.
you know, a, a really good measure of friendship is to see how they'll react to your bad news,
Mm-hmm.
because you know good news. Well, another good way is to give them good news and then see how they react if they give you positive reinforcement or not.
Mm-hmm.
It's
Mhm.
not like you're trying to play psychological warfare and just manipulate them,
Right.
but in an instance when you are giving uh, good news, and if you know they maybe downplay it, um, you know, it's a real thing that you want to take into consideration, because you do want to involve yourself with people who are going to help you
Mm-hmm.
and people who you can help, because this is a it's supposed to be a win-win situation. When you walk into college, you want to create the best environment that you can to help benefit yourself. If you're
Mm-hmm.
surrounding yourself with people who aren't going to assist you when you have bad news, when you're in your lowest point in anatomy, when you're the night before, and you think that you're second guessing every bone and tendon possible, uh, and every nerve innervation, you're starting to really find out who's who.
Mm-hmm.
Mhm.
And of course, most of us in our professional lives, you do need to work with a variety of people. So I think there's kind of two parts. One is as much as you can surrounding yourself with people who are positive and who
Mhm.
do bring something positive to you and to your interaction. But also then, like Kelsey said, sometimes sometimes we do have to work with people that might not be our first choice, but we then can become the agent of positivity in those
Mhm.
situations. We can be the one that doesn't fall into the complaining or the griping or the just kind of piling on, but rather, the one that shows the positive in the situation. And I think we started this conversation by saying, are you an optimist or a pessimist? And I think that really is one of the key things that an optimist can do, and that is
Mhm.
bring the positive and have the confidence to bring forward the positive, even if other people are starting to be negative, because
Mhm.
that can just totally change a situation. And I think most of us have seen that happen in our personal lives, and all of you will see it as students and then later in your working lives for sure.
And it could even like not only benefit like yourself from keeping like that positive attitude, but you can even help like the person you're working with to like see a
Mhm.
different side and then get them
Right,
to be positive too.
right,
Yeah, it's
exactly.
contagious, right? I mean,
Mhm.
there's even literature about, you know, even just faking the positivity to create your own positivity.
Hmm.
Yeah.
You know, if you say I am great enough, um, there is evidence that soon enough you may have the thought of, oh, I am great at this, or I am good at this. You build up the competency to it.
I do sometimes tell my students, so maybe I've said this in Kelsey's one of Kelsey's classes, but I normally I have a rather long commute, so I wake up generally around 5:30, which is fine in the summer because beautiful, but in the winter 5:30 is terrible, right?
Yeah,
It's
it's pitch
dark,
dark.
it's cold, no one else is up. And so it does seem really corny, but it's exactly what you said, John. Sometimes on those mornings, I will literally sit up on the side of the bed and say out loud in the dark to myself, it's going to be a great day. And I smile, like I make myself smile. And of course you feel totally corny doing it, but it is funny the power that that has to sort of,
Mhm.
it just kind of gets you out of bed in a different mood. And so yeah, it's kind of, I mean, positivity is big things and small things. And from the faculty side here at Cuca College, I really always try to be a role model for positivity. Like I said, I try to be a balanced role model in the sense that, I try to acknowledge that people do have real concerns and problems and issues sometimes, but also then to be a role model for how you can, sort of try to move through that. And I think, meeting people where they are. One of the things that I think you had mentioned in advance was, sort of what are strategies that faculty use um, to sort of help students be their best. And I think one of those things is, I think most of my colleagues here really do truly try to meet students where they are. And that starts with getting to know who students are and then valuing that and finding a way to use it and make it positive. I was thinking of another person I worked with who he was a young man with some pretty significant mental health issues, and I was working with him in a supported employment program. So I had done some evaluation and I was doing some actual intervention work with him. And it was, it was fairly basic. We were working on some really basic computer skills that were related to his job. But the thing about this young man was he had a very perseverative kind of interest. He was incredibly into Judge Judy. Does everyone know who Judge Judy is?
Yeah.
So whenever you would try to talk to him, he would always want to talk about Judge Judy. It was like an obsessive thought. It was something that he thought about a lot. He talked about a lot. And when I first met him, I, thought, which, you might have too if you first met him, like, we gotta like press down this Judge Judy thing because it's getting in the way of other conversation. It's hard to. So for the first session or two that I worked with this young man, I would try to distract him. Let's get to work. We've got to work on this job skill stuff. And try to like brush aside the Judge Judy. And then I went home one night and I thought, Sonny, you might be going about this the wrong way. Like you're trying to avoid this part of who he is because of what you think he should be. And so then that night I got online. I mean, I knew who Judge Judy was, but I had never watched any Judge Judy because, it's a daytime show and I never usually watched it. But I got online and I watched some Judge Judy, like just some parts of some episodes. And then the next time that I saw this young man, instead of trying to sort of basically get him to be somebody else by pushing aside Judge Judy, I came right into the conversation and said, "Hey, let's call him Scott. Hey, Scott, did you see that episode where Judge Judy had to make a ruling about, whatever?" And then he lit up and we started having this conversation about this particular case. And then to my surprise, he was perfectly willing to sort of shift gears and go into the work that we needed to do. But what had to happen first was I had to sort of meet him where he was and value something that he valued. And I think that that's often one of the skills that faculty can bring to their interactions with students, because we have a faculty that is close with our students, so we do get to know them, and we do, I think, try to use that idea of finding out what you as people value, and who you kind of are as people, and then using that as part of our relationship with you. So if anybody out there listening is a big Judge Judy fan, feel free, email Dr. Winstead and maybe we can But actually, in retrospect, that story, I don't really shine in that story because I didn't really realize right away. Like it took me a little while to realize that I needed to set aside my own thing in order to truly see him. And so, but I think that that's another thing that we really have the ability to do here at QKIT, which is get to know people for who they really are and then build on those strengths. We actually, in our therapy sessions, because we were working on computer type skills, we would also incorporate the Judge Judy stuff. So instead of just, doing random stuff on the computer, we would learn skills that incorporated, being able to look up stuff related to Judge Judy. And that was a motivator as well. So slightly to the side of our topic, but that idea of knowing who people are, valuing who people are, and I think a big part of positivity really starts there.
Yeah, well, it's also important, kind of in a group setting, in a career setting, to understand what people's motivations are, and adhering to those. One of the things that we worked on in Relate, one of the things that we reflected on as mentors in the living learning community is that um, there's some instances that people are really interested in, and so if someone works well in a group setting, all right, let's make sure that they're in a group setting at some point so that we can initiate that thriving portion of them and grow that strength that they have. Or if someone's closed off in a group and you recognize that, you see that maybe that's not their comfort zone necessarily. All right, well, let me sit next to them next group session, and before the group session starts, let's have this one-to-one conversation. Let's get comfortable with them. Let's figure out, okay, if they're comfortable in this one-to-one setting, okay, let's draw that out. Maybe next time we'll have a third that'll sit on the other side. And I know we've done this in Relate, and it's worked really well, where we start building on that conversation in numbers, and then that assists them to move forward. So again, I feel like this is a revolving door, but we've started small on their competency and saying, okay, they're good at this. They like doing this. They like having this one-to-one conversation. If it's interesting, or if we're just rambling on, then they're not interested. And then we start building off of that. That was one of the things that I find is interesting, is looking at someone's nonverbals and then kind of seeing where their motivation is when their eyes light up about a conversation about Judge Judy, maybe Jerry Springer, if anyone knows who that is. But yeah, kind of looking into people and understanding what their motivation is so that you can connect with them and communicate with them. I think that's one of the benefits of being an introvert, is not only can you reflect on, but you can reflect in a situation and on other people. And I think I have some introverted tendencies. Most people who know me think of me as very extroverted, but I do have some very introverted tendencies where I look at behavior and watch other people. I like to people watch. Okay, I'm not a stalker, but I like to people watch in groups, and I like to see what people are really interested in, because then you can connect with them on that. It's always a good tip, especially if you're going through your first week and you're in an NSO group that maybe you don't really know, but when you see people's interests that maybe align with yours, or maybe even don't align, but you can still make that connection with them. Um, do you have a question? Because I have a question. If you don't, Kelsey. So at QCO we talk about an edge, and we talk about finding your edge at a liberal arts college. One of the things that QCA is really good about is about helping you find your edge, your, so to speak, specialty within a specialty. And so I was wondering what your edge is, Dr. Winstead, if you think of one, and we can go from there.
Um, my edge, which I guess I sort of think of that as my interest and also my expertise, the thing that I've taken steps to actually become expert in, is the area of research and scholarship. And that is something that I did not really do much with when I was a clinician,
Mhm.
but it's a role that I've really grown into here. And I think that a couple of things. I think it stems from my own interest, right? I like to read. I like to read critically. I like to write. I like to analyze. Uh, I'm interested in the idea of how we make the decisions that we make as clinicians. So are we just kind of winging things off the cuff, or are we using evidence to support the decisions we make? So that lots of pieces have interested me, and I guess, two things have really happened, I would say, in terms of developing my edge, and these may relate to many students as well. Number one is I reflected on what my own interests were. And I did do kind of a process of thinking about how do I want to start to direct my teaching career, because you can certainly drift around. But most of you over the next year or two will be in that process of identifying what it is that really interests you and then figuring out how you want to take steps in that direction. So for me, I already had my degrees, so it wasn't a matter of choosing a major, but it was a matter of saying within my current scope and setting, what really interests me. So what am I going to intentionally start to aim toward? And then once I had done that reflection part, then it became a process of setting some goals. So, okay, I know what I'm interested in doing. How am I going to get there? And for me, that started quite a few years ago with the identification of a mentor. So I knew that I wanted to move into teaching, research, and scholarship, but it was new to me. And so I intentionally reached out and found a mentor on the faculty, somebody who's has since retired, but was a PhD OT with a lot of experience in research and scholarship, and she guided me in those early couple of years of moving toward that edge. She guided me in things that I could do that would actively build my skills and that would actively kind of position me for opportunities. And then once you've reflected and identified it and you've started to put some goals into place, the third thing that happens is opportunities start to come your way because people start to know that you're the person who has a particular interest or particular expertise, and then opportunities come to you. So, for example, I'm a peer reviewer for a national peer-reviewed publication, and having met and known the editor of that publication, she was then editing an OT textbook, one of the two kind of probably most prominent OT textbooks on adult physical dysfunction. And so she reached out to me and asked me to author a chapter. And that to me was a really great example of that sort of process of, me starting small with my goals, getting some mentorship, starting to build my expertise, and then eventually having opportunities begin to come my way as a result, and then having the confidence at that point to grab onto the opportunity. And I think that process is probably something that many of you will relate to in your college career as well.
Yeah, I mean, I was first a nursing student.
Mm-hmm.
Like the goal in mind was to like impact people,
Mm-hmm.
like and take people from the standard that they're at now, or whether it's health or mind or any type of wellness, and try and elevate them in any way that I can. And so I started with nursing, and then I got this interest in intro to human development from Dr. Koberstein, and started speaking with him and started doing other things with him. And then I picked up a minor in psychology, and then I got addicted to psychology, just and still addicted. Um, and then I picked up the major, and then that's where I was like, okay, now I'm starting to really identify what I want
Mm-hmm.
actually. I was already aiming in the healthcare field, to impact people, to help people. And then I kind of figured out what my real goals were, working in a group setting and that organizational leadership, and then moving to psychology because that's where I felt that it was most beneficial for me. That's where I kind of picked up and was able to use my strengths. And so then I made the full switch.
Mm-hmm.
So it's perfectly fine to switch out of a program or major. And that's maybe something that people should hear, is that if it doesn't fit the goals that you've aligned, then let's reorient yourself in ways that we can fit for those goals that you have in mind.
And I often say to my advisees, John, that there's more than one right path in life. It's not like there's only one thing that, because I think sometimes people get really overwhelmed with the idea that at 17, 18 years old, they have to choose this thing and it has to be the thing and it can never change. But for most of us, there are really multiple things that would suit us and interest us. And so it's okay to not necessarily hit on the right thing right away. But I do think both of us, and I'm guessing, Kelsey, you may jump in on this too, because that process of identifying your interests, identifying goals, starting to set sort of steps for yourself, whether it's like in my case, coming up with a mentor or whatever. I think everyone really goes through that process. And even if you've come into college thinking you're pretty sure what you want, I think it's still really valuable to let that process play out. And sometimes it does change ultimately your major or your thoughts about your future. Did you come in, Kelsey, and just know right away what you wanted to do, or have you had a process?
I kind of have two. Like for OT, I either want to go into like the military field and like take it like in with me, or I really want to work with pediatrics in a hospital.
Mm-hmm. Mm-hmm.
So those are like my two that I've been like balancing through or like switching through. I've always told my parents I do not want to work with geriatrics like at all. And
Mm-hmm.
I've kind of like avoided it up until now. So I've been really trying to push myself for like junior year. That's where I'm going, is I'm going to work with the geriatrics. So
Mm-hmm.
we're going to try it.
Well, and again, that's another great example of that idea of reflection. And the word I think that gets used a lot, but like the popular word lately, is intention or intentionality. But the idea that you're not just kind of drifting through life, but you're reflecting, you're making decisions about what you want to do, and then you're making intentional choices to move in that direction.
Mm-hmm.
So whether that relates to intentional choices for career and future, or just more broadly, our conversation today has been a lot about intentionality when it comes to positivity. You have the intention to be a more positive person, and there are things that you can do to move toward that.
Yeah, you talked a lot about, with that professor to student interaction, meeting them where they are, and then working on a trajectory in a sense,
Mm-hmm.
trying to find goals that adhere to them so that they can move from where they started. There's no such thing as a starting point necessarily, but we're going to start anywhere you'd like and move forward on that.
Mm-hmm.
Doesn't really matter about where you're starting. That's for
Mm-hmm.
sure.
Yeah, yep, that's a good point.
The cliche journey.
Mm-hmm. Yeah.
Um, so we are about at an hour or so. Would you like to keep going? Stop here? Um, I think I have a meeting at 11.
Yeah, I'm going to actually have
Yeah,
to go. I have to get ready for
yeah.
work.
Well,
She has work.
I think
So
we had a great conversation. I think we've worked around the general
Yeah.
concept of positivity and personal reflection and growth, but I think touched on a lot of different things. So,
Mm-hmm.
um, I'm happy to conclude whenever you guys are ready. I appreciate the
yeah,
chance to talk to our incoming freshmen and to just really wish everybody well and a great start, but also to keep in mind that, even if things don't get off to the perfect start, that doesn't mean that it's not the right start for you. Everybody has things that they need to work through. Everybody has things that don't go completely perfectly, but moving toward a greater sense of positivity and growth, that is what's supposed to be happening. And sometimes it is a little bumpy, and that's okay too.
Yeah. College is about the individual. You're the one paying for it, not
Yep.
your friends. So, all right. Well, thank you, Dr. Winstead. We appreciate
Thank
your
you.
time. We'll see you soon in the weight room.
Yes,
Hopefully.
I certainly.
Okay.
Thank you both very much.
Yeah.
Thank
Okay,
you.
All right.
bye-bye.
Bye. Take care.
Bye.